admittance here at Dr. Gatlin's office is our admission forms. Most of the time our clients are already in our computer, but if they're not, we like them to fill out this paperwork. This is client information and pet information. So today we're doing Tuco. He is a 2-year-old Chihuahua. He's tan, with no markings. We also make them fill out like if they've had rabies or have been vaccinated for other contagious illnesses, heartworm preventative, and telling us why they're here. And today he's here for a routine neuter procedure. So patient medical history, we have Tuco's information on our computer already. We try to stay paperless as much as possible. So on his history, you'll just go to the patient name, tap him in, go down, and it shows our medical records by date or by groups, and then the general information. So part of our check-in is our surgical consent forms. It's very important that they fill this out. On here we also have our laboratory work that we offer, like a prep profile. We have our full comprehensive profile. If they want intravenous fluids during anesthesia, that's optional. Just any kind of pre-anesthetic blood work. We also do additional services while under anesthesia because it's a lot easier to get done while they are sedated. If they want post-operative take-home medication, we offer that so they can just fill it out for us and choose what they select. We always recommend getting blood work and the fluids done. It's very imperative to the patient's health, and if anything goes wrong, it would be able to tell us, like the blood work would be able to tell us like how the kidney functions are doing and anything to do with anesthesia. So then under anesthesia and the sedation, we have that authorized, and it kind of gives them a warning about the risk of anesthesia and surgery for their pet. And their signature is their consent on this. So this is our surgical and our anesthesia consent form. Got a print cage card for Tuco. Open it, gives it a moment. We have to do this with every patient that comes in. We like to zoom in, make sure all the information is correct. Then we'll print. Make sure you have the right label maker. Okay, so now we have our label that'll go on his kennel, and we it doesn't say what the Chihuahua is here for, so we would like write neuter or whatever on this label. And then also to make sure that we have the right animal, we also have this sheet right here, which is Tuco's. This right here tells us like he's here for a neuter, and then when we go through and do any work to him, we go through and circle it, and that's how we kind of help do the invoices as well. So we want to make sure that our label is on the right patient, on his kennel, that matches with his paperwork. This is our post-surgical take-home sheet. It says your pet underwent a surgery procedure today. Because of the anesthetic drugs used for the procedure, your pet may experience some drowsiness or nausea. Please keep your pet calm and rested for the first few days after surgery to speed healing. You'll also need to observe the incision site daily to make sure the area is healing well. It has our emergency number on here, just in case they need to reach us. And they're able to contact us at any time. If they are lethargic for more than 24 hours, loss of appetite, labored breathing, discharge or bleeding from the incision site. We also indicated that some redness and swelling is normal. Vomiting for more than 12 hours after surgery, severe pain, depression, or weakness. As far as pain medications go, most of the time we do an injection of pain medication that will last for 24 hours. If they elected to receive additional pain medications to take home, we start them the morning after surgery because they receive that pain injection that same time. For cats, we offer the Onsior, which is 1 tablet once a day. For dogs, we normally do carprofen or the Quellin tablets, and we also recommend that they put those up because they smell really good, and some dogs try to like break them and eat them. And we do that based on their size, on how much we send home. Please do not bathe or allow your pet in water for 10 to 14 days after surgery, because if their sutures are dissolvable, you don't want them coming undone. They'll start to itch approximately 3 to 5 days after surgery. If your pet begins to chew or lick at the incision site, they may need to come up here and utilize an e-collar, which can be purchased here at the clinic. And then it tells at the bottom that whether or not the pet's sutures are absorbable or if they need to be removed in 10 to 14 days. So they can take this home and read it, and we try to read it, go over it with them before they take the patient home. Fritz here is going to help us demonstrate how to do a jugular blood draw. So we would get down and lift his head up like this, and if he was wearing a collar, we'd pull it up, and that way the vet or the other technician can draw his blood. And sometimes it helps if you can lean him over the table and lay him down. Come on, Fritz. Okay, like that, and pull his leg off of the table. For a cephalic blood draw, you would restrain him in the pit of your arm and pull his leg out and lay it down, and then whoever can draw the blood with the tourniquet on. This is going to help us demonstrate how to restrain for the saphenous vein on a canine. So there's the vein right there, and that's when I will hold off, and the technician or the doctor would draw blood. I'm going to demonstrate how to get a patient in and out of a cage. So, hot rod over here. Got declaw today. So, because it's a cat, I would get him out and I would scruff him and place him in his kennel if he was going home, or just put him right back in. And if he was sedated, we would put him back in and make sure to monitor his temperature. And most of the time, we would put a heating pad in there with them and make sure they stay warm. I'm going to demonstrate how to put on a muzzle and take off a muzzle off of our dog Fritz here. So we're going to place it around the snout and then buckle it in the back and then tighten it accordingly so it does not come off. And now he will not be able to open his mouth to try to bite us. And he's very friendly. He wouldn't bite us. Fritz is also going to help us demonstrate how to put an e-collar on, an Elizabethan collar. We're going to place this over his head. We pre-measured it, and we're using gauze to tie. And you're going to make sure you place 2 fingers. So if you'll place 2 fingers, your assistant, and then we will tie. So flat, there we go. And then you'll tie it. There we go. So he has room to breathe, and it can't just slide right off his head. So Fritz is going to allow me to do a TPR on him. So we're going to take his temperature, and there is lube on our thermometer. He's a really good dog. Okay, 102.5. So this will get disinfected. And now I'm going to listen for his heart rate. And I need to make sure that it gets written down so that we do not, so we can put it in the records later. Okay, for heart rate, I need to get to where I can see a clock. And I'm going to listen for 15 seconds and then multiply by 4. Okay, so I got 30. We're going to multiply that by 4. It equals 120. And now we're going to do his respiratory. Sometimes it's easier just to watch them for 15 seconds, but if you don't have a clock in front of you, you can just count. So ready? Okay, I got 10. Multiply by 4, of course, is 40. And now I'm going to do a heart and lung auscultation. Make sure everything's going all right. Yeah, everything sounded fine to me when I listened, but I'm going to listen to different sides of the heart, okay? So you hear the systole and diastole, and you'll listen to different quadrants of the heart. And then we'll listen to the lungs. And they should be a clear airway. Like you shouldn't hear any wheezing, any kind of congestion at all. His heart sounds really great. There's no murmurs or anything. No crackling, nothing like that. He seems overall to be very healthy. Okay, so this is Sammy. She came in as a sick cat, and we are going to take her TPR on her. Right now I'm taking a temperature. I used a lubed up thermometer. When I was going to take a temp, I noticed that she did already have some loose stool around the rectum area, so that's something I would note. She hasn't been feeling too hot. Okay, so her temp is 97.9. That'll get disinfected. That's low for a cat. Normal is 101 to 102. 97.9. Okay. And now I'm going to do her respiratory and her heart rate. So she's kind of breathing rather fast. I'm already looking at that. But I'm going to go ahead and, do you have your time? Mm-hmm. Try not to start making her purr, but I think she's already purring. Okay. You ready? Stop. Okay, I got 15. We're pretty much matched up the clock. So 15 times 4 would be 60. And we're going to make sure to document all of our findings for the vet. Okay, and now we're going to do her heart rate. I'm going to see if I can hear anything. And start. Stop. Okay, so for that one I got 31. But it's kind of hard to tell because she was purring. But 31 times 4 is 124, so that's what that is her heart rate. Another way to check is to put your hand placement right here and check her pulse that way. And since cats like to purr a lot. Okay, so as far as her ASA goes, I would say she's a grade 4. I do not recommend putting this cat under anesthesia. Upon doing her exam, she has jaundiced ears. Her ears are yellow. Her eye is starting to yellow. This is a geriatric patient. We would definitely need to do blood work, and it would probably show that she is anemic. Dr. Gatling does think that she has IMHA. So she is immune-mediated. Her dehydration status is slightly dehydrated, so we would have to put her on fluids. I'm going to do a cephalic blood draw. I have my tourniquet on. I'm going to shave. I'm going to use my cotton alcohol swab. Here we go. Okay, pretty simple. We got blood. So now I'm going to draw blood from the cephalic vein. So we got our tourniquet. There we go. We're going to shave right where that vein is. Okay, and Cutter, our assistant's holding up the cat because he is sedated. I'm going to take our alcohol-soaked cotton ball. We have our tourniquet on. We're going to insert and then draw black. And we have blood. And our syringe. Perfect. some normal databases for the clinic that I work at is temperature, heart rate, respiratory rate, mucous membrane color, capillary refill time, blood pressure. Temperature normally for dogs and cats is 101 to 102. For heart rate, for dogs it's 80 to 160. For cats it's 140 to 220 normally. Respiratory rate, we want 16 to 32 RPMs and 20 to 42 RPMs for cats. On the mucous membrane color, pink is normal. There's all kinds of different colors that indicate different problems. There's pale, blue, red, yellow, brown. So any of those can indicate different things. As far as the capillary refill time, less than 2 seconds is normal. Over 2 seconds indicates a problem and should be addressed by the veterinarian. Blood pressure, you want it resting at 120 over 80. Anesthetized is over 90, systolic over 60 is diastolic. So we use all of these to go by in our clinic. Any kind of signs that are over, anything that indicates a problem, we will record for Dr. Gatlin. So additional tests based on our findings, ECGs, sonograms, radiographs, doing a UA, anything of that sort, any kind of lab work would help us with our findings. If you have a patient that comes in with really pale gums, you might do a CBC or a blood chemistry panel to find out if that patient is anemic. Different signs can tell us what kind of tests we need to run. So Dr. Gatlin and I determined and discussed the appropriate anesthetic and peri-anesthetic protocol we would use. The hydromorphone, we would use that. That is for pain control and relaxation. It's a sedative. And the midazolam for pre-anesthetic sedation for compromised patients or patients that tend to have seizures. We induce with ketamine, which also has an analgesic property. So part of our duties as techs is to kind of keep up with the controlled logbook. Our computer system that we have keeps up with all of that data, but sometimes it's really good to have paper to back up our computer system. So on this controlled logbook, dispenser doctor would be Dr. Gatlin, so I'll write her initials. The patient we're doing is Stella. She's a canine. She's a lab, female, 6 months old. And then our net change, we gave her 0.3 mils of ketamine. So you're going to subtract that from your balance. So now we're down at 78.3 mils. And then the next person that fills out this line will have to subtract from that number, and so on. The difference between a rebreather and a non-rebreather, this one right here is hooked up to a rebreather. This one right here is a non-rebreather. This one's typically used for animals under 10 pounds. This one is direct. They don't have to rebreathe in the carbon dioxide, whereas this one circulates. And I'm done with that. I'm going to perform a leak test on our anesthetic machine. The pop-off valve, I'm going to turn it closed. I'm going to turn our oxygen all the way up. Fill this bag by holding, and when it hits the 20, that's when I will let it sit and see if it leaks. Okay, I'm going to turn this all the way down and hold. And then it seems pretty good. There's no leaks, and then release. I'm going to discuss different parts of our anesthesia machine. This right here is our oxygen tank that flows into our regulator, and then through this green tube flows into the flow meter, and the regulator helps with the pressure, and this right here determines on how much oxygen you would like your patient to have on what level. Then from flow-meter. We have our vaporizer, which is right here, and you can set that on the different setting that you would like it to be on. This is where we put our isoflooring in. And then we have our inhalation unidirectional valve, and so this right here is the inhalation unidirectional valve, and then this right here is our exhalation unidirectional valve. This is our breathing tube right here. We can change this out to different sizes. We can do a non-rebreather, we can do a rebreather, depending on your patient. So we have our oxygen flush valve right here, which would not be on a non-rebreather. And then we have our pop-off valve right here. This is to open and close. This can control this bag right here, and if you need to fill it up with oxygen. And then we have our soda lime canister, and it's a CO2 absorber, and when it turns purple, it's time for a change. And then we have our scavenger system, and that right there filters out the gases, the different types of gases. And then we always have our cuff syringe on hand to inflate or deflate the cuff. Our scavenging system, this is all part of the machine. This right here filters out the gases, so it goes also through the soda lime machine and then through the scavenging system, through the scavenger hole. And this right here is our oxygen tank that we have. It's upright, it's chained. We have to make sure that it's continuously always has oxygen in it. I'm going to demonstrate and attempt putting in a saphenous vein catheter. I'm going to shave where the saphenous vein is, and Jalen is going to hold off for us. So I'm going to scrub using our alcohol. And our iodine scrub. Last scrub.
Alcohol again, right?
So I had a flash, but I could not advance, so I tried to straighten it back out. There it is. Okay. Okay. My blood is coming out. So I definitely need to test that and make sure we're in. And sometimes just moving it around will help. This one's a lot harder than doing a cephalic. And this one we do not use very often. And courtesy tabs are always welcome. And now we're going to flush and see if it's in. And your flush should go in easily. And you should be able to feel it in the vein. And it's in the vein. Perfect. I'm going to demonstrate how to do subcutaneous injections as well as intramuscular. Earlier we did intravenous already. So subcutaneous, just form a tent, inject. Perfect. And intramuscular, stick right in the muscle, inject, and then hold off. So it's very important to pre-oxygenate your patient for at least 5 minutes before we give the induction agent, especially in patients like C-sections, anything that you are going to sedate. It helps get their oxygen levels up. I'm also wearing my lab coat in this area before, while we scrub and we shave and all of that, so I don't contaminate our surgical area. So we're going to do this and then sedate. I'm going to sedate our patient. We're going to give this intravenously. This is our dexdomitor. We're going to give 0.4. He weighed 25 pounds. So we're going to give this with the IV catheter, and this is the pre-med sedation. And now we are going to flush that through the catheter. And in a few moments, we will give our ketamine. It's fully sedated. This is Dr. Gatlin. She's going to help assist with the endotracheal tube. So we're going to intubate. So how you measure, so use that part of the nose right there, the top part, and you'll place your endotracheal tube up to it and see which one is a good measure. And they both look like they would fit rather well. We're going to go with the bigger one so you don't have more backflow going in. And I'm going to show you how to make sure that your cuff is actually working. So you'll grab your syringe, fill it with air, and inflate the cuff until its balloon is filled. And then I'm going to go ahead and undo it so that I can place it. And you got to be careful from over inflation or under inflation. Okay, so we're good to go. Dr. Gatlin's going to hold open the mouth, and I will grab the tongue and the bottom jaw. My patient, there we go, is coughing a little bit. That means most of the time that indicates that we are in. And you're going to tie there we go. Okay, and now we're going to test and make sure that it's in, and I can feel the air, and I can also see it at the end of the tube, so that's perfect. We are in. And now we're going to inflate our cuff. Okay, and so it still has a little bit of bounce to it, so that's perfect, because if it was way too tight and you didn't have the bounce to it, that probably means you overinflated it. Okay. Our patient is intubated. We are going to put this eye loop into his eyes because he's going to have his eyes open for the remainder of this time. So add a good glob in. There we go. And keeps them hydrated and moist. Perfect. Spay, and we are going to express her bladder before surgery. So you palpate and you get a good hold of her bladder, and you're going to go ahead and, if there's any urine to come out, we have expressed the bladder. It was rather small, so she didn't have much urine, but I cleaned her up and everything. So now we're going to shave. So I'll explain what we're doing. We're going to shave right underneath the rib cage, and we're going to make a rectangle. And it's very important that you have a clean shave because that is what the owner will see. It doesn't matter how pretty your doctor does the spay. the outside is what they're going to look at. So I'm going to shave her really quick, and then we're going to do our scrub. Our cat is completely shaved. I made sure that I did especially well on the incision line, which is the linea alba. So we are going to use our betadine soaked gauze, and we're going to scrub in the middle really well, and then we're going to go around making a bullseye, making sure to not go over the same spot twice. You're going to go all the way up. Make sure you get on the sides. And make sure you throw your gauze away after you do it. You're going to do this 3 times. Last scrub. Now we are going to spray with our alcohol.
I wish I had been around kids when I was your age, because I would have
Wipe off what we just scrubbed. And we are going to do our last scrub over at the OR table. And then spray with our betadine solution. So because we do not have a sling, we do use towels. If this was a big dog, we would use a stretcher. So we're going to try to do this and not contaminate what we just scrubbed. Okay. Now we're going to go over to the OR. Okay. Making sure that his legs do not flap over. Okay, go ahead that way. And cut. I am recording an operative record of my patient while he's sedated. So we do the blood pressure and everything 5 minutes apart, and we check the temperature and the SpO2 every 15 minutes apart. I'm using my EKG machine over here to help us. So I'm going to go ahead and push the blood pressure cuff to go ahead and get a reading on that. So we wait for that. So I'm going to go ahead and write everything down on my next 5-minute mark. Our heart rate is 143. Our SpO2 is 87. Okay, our systolic is 94. Our diastolic is 57, and our mean is 69. Our temperature is 102, and he's dorsal. And our respiratory rate is 23. And so we would do that every 5 minutes and every 15 minutes while the patient is sedated. It is very important that you just don't rely on the machine for your readings, and you also use your veterinary technician instincts and listen as well. So Dr. Gatlin is going to help you demonstrate how to do CPR. So most of the time with our patients, this one's kind of small. You could do this right here with both of your thumbs touching and pressing of the heart, and you can feel the heartbeat right here. Or you can put your palm down and start pumping. And I'm not going to press too hard because my patient is not in respiratory distress or cardiac arrest or anything. This is just for demonstration. So Dr. Gatlin's going to show us how we take a breath. So she's going to close the pop-off valve for a positive pressure breath and pump once, going up to the 20, no more than 30, and then open it back up, and then that's when I'll start pumping again, staying to the beat of staying to alive. I'm going to demonstrate how to do a surgical scrub. I'm going to take my rings off and open my Easy Scrub packet. And inside, there's a little pick to get underneath your fingernail. Get all that dirt out from underneath. Okay. Now I'm going to get my sponge and lather it and start scrubbing. And I'm going to start with each finger and do 10 times. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8. Hand up, I'm going to go in, letting it drip back off. Okay, on this side, going to do the same thing, letting it drip. Okay. Like that, my hands are wet.
Yep.
So now we're going to go over here
Bury your hut towel.
to the hot towel. So I'm going to set up our surgical tray.
John, we're going to need this blade too in just a minute. We'll need a blade. We'll have to move out of the way in a second.
Are you getting me doing this?
Do what?
I was asking you if you got me doing this. Thank you. Okay, our tray is complete. I'm going to load our scalpel with the number 10 blade, and it's angled. So you fit it into this groove, like such, and push down. Be careful not to cut yourself, and it snaps right in place. I'm going to prepare the drape for the patient, for Dr. Gatlin, our surgeon, to be able to go ahead and start surgery. So I'm going to cut
And you can open it up as much as you want.
right in the middle.
Just keep it on the tray.
Using our scissors and making an elliptical. Is that good to you?
Yep, and come up.
Come up?
Yep.
Okay.
Okay.
And then placing the drape.
Uh-huh.
Do I go
So
under?
hold it up and open it up, and then put, well, this will be toward her head.
Okay.
So just open it so that you can see it, and then you're going to put it right on top. Okay? Visualizing the umbilicus when you do it.
Okay.
Okay?
Ready?
Yeah. However you want to do it. If you want to do it like this and place it forward,
Okay.
you just don't drag it, you know. Do you need some help? Do you want me to help you?
Yes.
Okay. Okay. And I want you to see the belly button.
Okay.
See the belly button?
Yes.
Place it right down.
Okay.
Okay, right there. Let me pass you some clamps. Okay, I want you to clamp just right above the belly button right there. Okay? Okay. And then you can put one down toward both cobble edges. Gee, it's hard to get. You're doing good. Okay. Hang on. All right. So we have it. Hang on. So I have broken sterility, trying to help you, I'm pretty sure. Maybe not. Let's see. Might have snagged it. I guess I didn't.
There is a God.
Is there a hole?
I said there is a God.
Right. Okay. So I didn't, but if we had, what would we have done?
We would have degloved.
Mm-hmm. And regloved, and we would have also discarded that and gotten a new one out of our packs. Turns out we didn't. It was just a close one. Okay. Here we go. All right.
All right. So mosquito forceps.
Got a little bit of juice right there.
And I'm going to dab. Okay. So my duty as a surgical vet tech is to stay as sterile as possible, pass Dr. Gatlin the correct instruments when needed, blotting during surgery, just giving her a helping hand, trying to stay as sterile as possible without touching anything in the outer field. Anything on the blue is sterile. As far as the table goes and stuff, I have to stand back, and I can't mess with the oxygen machine or anything like that. So post-surgical cleanup, we're going to put our pack away and take out all of the instruments and clean them. We're going to take out our trash that's filled up at the end of the day. Our heating pad that we've used, we're going to wipe it down and sterilize it. We're going to hang up all of our leads after cleaning and sterilizing them. And then anything over here in the sink that needs to be washed and put up, we will do. We've already put up all of our sharps into the canister. And so now I'm going to wash my pack. It's also important to make sure everything is turned off. Your anesthetic machine, the gas, you don't want to leave any of that running throughout the night, and your surgical light. So my instruments are all dry. I'm going to spray them with surgical lube, aka surgery milk. And then I'm going to place them. I'm going to snap them all together. And the lube helps keep them running very nicely. And you want them to be from the biggest to the smallest when you do this. So you kind of measure out which one should go next. Some of them don't snap very well. So just put them in the best order that you can. Here we go. There we go. And you place them over here on a clean hook towel. Putting your snook hook in all of them. Laying them like that, and then placing your other instruments right next to them. And we put our gauze on top, and along with our needles. We have different types of suturing needles. We put our drape on top, and then we fold nice and tight. So the tighter, the better. And sometimes the snook hook can kind of get in the way of that, so you got to do it properly. You can go ahead and pause. It's a pain in the ass. Did not want to close all the way like it should. You're not still filming, are you?
Yep. Am I supposed to be?
I told you to pause. So I'm going to place this tape on both ends. And this tape lets us know if the autoclave did its job by sterilizing the instruments inside the pack. And here we like to write exactly what the pack is. So this is a spay pack. And then we write our initials on who did the pack. So this is our freshly washed surgical gown. This is the front of the gown, which you do not want anyone to touch. You want this to be as sterile as possible. So we are going to fold each of the sleeves inside across each other. And then fold this to where your sleeves are angled. You're going to do that on both sides. Now we are going to accordion fold. Each side. So accordion fold the whole thing. Okay, G. So now you're going to take this part, the top, and fold it back with the tag out, and then accordion fold it. So when they go to gown, they will grab this part right here and then be able to stick their arms in. And now I'm going to wrap it. Fold it on top. Tape, which again resembles if it is sterilized. And now we're going to sterilize it. So this is the autoclave that we use at our clinic. This one is automatic. It's not a manual one, which is a blessing for when you're really busy. So the way an autoclave works is it gets extremely hot and it has pressurized steam with an extreme temperature. And that right there sterilizes against viruses and bacteria. It helps sterilize our gowns, our surgical instruments, any like kind of pouches that we put in there, or unwrapped instruments. So it does a series of of things for us. So the pressure and the temperature all depend on what setting that you hit. It'll automatically set that for you. And most autoclaves come with a manual on how you're supposed to run the machine and everything. It also tells you what to do as far as maintenance goes. We always have to make sure that this is filled up to the green with distilled water. Failure to use distilled water could result in equipment damage or personal injury, is the warning that is said. So I'm going to go ahead and load this autoclave. So the difference between a sterilized pack and a non-sterilized pack is the tape that we used. This one has been sterilized and this one has not. So I'm going to demonstrate how to load our autoclave. So I just have one tray in there right now. There are multiple options for other trays to be in there. So I'm going to have it loaded. We have plenty of distilled water. We lock our machine beforehand. We're going to go ahead and hit start. We're going to hit on. And then we're going to select what we have in there. So we have packs. And this one automatically sets it for the time and the pressure. And we'll hit start. And if like the water was low, the door was open, anything like that, it would alert us. And now the autoclave pretty much does its own thing and it opens on its own and lets the steam out when it's ready. I'm going to demonstrate how to remove a staple in this case out of a post-operative patient that we just did. So if it was sutures or staples, and you would tell that they would be able to be removed normally within 7 to 10 days. Most of the time the incision is completely healed, as long as there's no pus or a lot of redness or indications that that they're not ready to come out or that it's infected. So here we go. So just place that underneath there and just release it and pull it right out.